Time now for the Business Spotlight here on News Talk 94.7 and 970 WMAY. Today visiting with SIU Medicine and specifically talking with Dr. David Jeong. He's the Assistant Professor of Family and Community Medicine and the Director of Geriatrics and Palliative Medicine there at SIU. And Dr. Jeong, thanks for being with us today. We want to talk a little bit about falling and the elderly and how we can prevent that. What is there an age when people tend to start to fall more often?
Yeah, so according to the studies, the people whose age is at 65 or older may have an increased risk of falls. One-third of patients whose age is over 65 may experience at least one fall a year. But if your age is over 50, and then you have significant medical conditions with multiple medications, then you may still have risk of the falls as well.
What are some of the common factors that might lead to a fall, and maybe things that someone might want to consider, particularly if they have older parents or grandparents, or they themselves are getting older?
Yeah, so there are so many different risk factors, including the patient's the physiologic factors and also environmental factors as well. So when they have multiple medical conditions and have multiple medications, more than 10 medications, then they can have falls from the polypharmacy. When you take too many medications, usually the different medications interact each other, which will increase the side effect profile. And then also, as the people get older, they will lose the balance, and then also they usually have at least one or two musculoskeletal conditions like arthritis or tendinopathy, which will also affect their ambulation as well. And then many times, many old people don't use a necessary assistive device, which can prevent them from having falling. And then also, if you have diabetes and then the blood sugar is too tightly controlled, then your blood sugar can go down significantly, which will actually cause symptoms such as dizziness and then drowsiness, and then you can have fall. If your blood pressure is too tightly controlled, and then that can also cause what they call orthostatic hypotension, which is like a fall related to postural changes because of drop of the blood pressure when you try to stand up or change your position suddenly.
Is there a place where you tend to see people falling more often?
Yeah, so mostly people will have fall at home. A lot of studies shows that fall can happen at any time and any place, even in nursing home or assisted living. So just to make sure to do like a very clear and then thorough fall prevention and then precaution for the older people.
We're going to talk a little bit more about this on fall prevention for the elderly with Dr. David Jeong from SIU Medicine. More to come here on the Business Spotlight on News Talk 94.7 and 970 WMAY.
Providing high-quality care, innovative education and research, and community services in 66 counties. SIU Medicine serves 2.2 million people in central and southern Illinois. Services include 5 community health centers through SIU's Center for Family Medicine. SIU Medicine offers state-of-the-art education, patient care, and research in a warm, caring environment. SIU Medicine. Forward for you. Visit siumed.org or call 585-8000.
And we're back now on the Business Spotlight on News Talk 94.7 and 970 WMAY, visiting with Dr. David Jeong, who is the Assistant Professor of Family and Community Medicine and the Director of Geriatrics and Palliative Medicine at SIU Medicine, talking today about fall prevention for the elderly. And when a person does fall, Doctor, what are some of the long-term consequences that are attached with that?
Yeah, so number one, developing fear of fall is the most significant problem after a one-time fall. as they experience fall, which is traumatic experience, they don't want to walk or do more like a physical activity or outdoor activity because they don't want to have fall again. And then the consequence is, so as they go through physical inactivity status, they will go through muscle weakness. And then also they will put in the high risk of the falls as a consequence. And then number two, as they have like a more aging in their late life, the osteoporosis, the weak bone, is very common in elderly population. And then fall-related fracture is very common in patients with osteoporosis. If you have fall-related injuries, especially like fracture, nobody guarantees that you may have hip fracture or vertebral fracture, which needs like a prolonged like a treatment and then resting period. According to a lot of studies, actually 10% of older patients who end up having fall will be institutionalized at the long-term care nursing facility because of hip or vertebral fracture.
And my goodness, I have heard so many, just even relatives of mine or other elderly who have said that one of their biggest fears is of falling, and it seems like it just sort of exacerbates itself because you're not moving around, you're not doing the exercise things that can help to keep your body healthy. I guess the most important thing would be to reduce the risk of falling. How would you do that?
Yeah, so most important intervention to reduce the risk of fall is exercise. So there are many ways that we can achieve the goal to increase the physical activity and then promote the exercise for older people. It's
good information and important information. I appreciate you spending time sharing that with us. Dr. David Jeong from SIU Medicine. You can find out more at siumed.org. And you're listening to the Business Spotlight. This is News Talk 94.7 and 970 WMAY. WMAY. WMAY.